COVID trackers say the virus is coming from outside the county.
KIRO FM Tacoma, Seattle. Here for what's next. This is CBS News on the Hour, sponsored by Eggland's Best.
I'm Peter King in Orlando. More than 60,000 people hospitalized, more than 1 million new COVID-19 cases in 10 days around the country. Renee Edwards of Oregon Health and Science University on what can happen as hospitals fill up with COVID patients.
We start becoming overwhelmed, then pretty soon those beds are in the hallways instead of in a room.
CBS's Lilia Luciano is in Los Angeles.
Coronavirus cases are soaring in California, with the number of patients hospitalized over the last 2 weeks increasing by 32% and ICU admissions up by 30%. Health officials in the Golden State announced 11 counties are falling back on reopening plans, including Sacramento, San Diego, and Stanislaus, which are now in the most restrictive tier, having to shut down gyms, indoor dining, and churches. Lilia Luciano, CBS News, Los Angeles.
An embarrassment. That's what the president-elect calls the sitting president's refusal to recognize that he lost, but Joe Biden says he's pressing forward with or without Mr. Trump's help.
We're just going to proceed the way we have. We're going to do exactly what we'd be doing if he had conceded and said we've won, which we have. And so there's nothing really changing.
Now, the White House has told government agencies not to help the Biden team. CBS's Ed O'Keefe.
Among other things, the Biden transition team at this point should be getting classified briefings, access to secure facilities, the ability to submit more names for background briefings. They can't even talk to the State Department yet to help them facilitate the calls that they're getting from world leaders to congratulate Mr. Biden.
North Carolina Republican Senator Tom Tillis has finally won re-election over Democrat Cal Cunningham in a tight race that was also the most expensive Senate race ever. It cost more than $280 million. A New York City man is being held for making post-election threats online. More from CBS's Andy Trier.
The Joint Terrorism Task Force arrested a 54-year-old Staten Island man this morning for threatening to kill protesters and others related to the election.
Prosecutors say Brian Majorana wrote about carnage and, quote, the extermination of anyone that claims to be a Democrat as well as their family members. He's also a registered sex offender. A veteran Palestinian peace negotiator has died from COVID-19. CBS's Imtiaz Tiab.
For over 40 years, Saeb Erekat was at the heart of the Palestinian struggle for statehood, consistently fighting for a two-state solution based on the 1967 borders. He was often lauded and loathed in equal measures. Israelis would accuse him of being an extremist, while hardline Palestinians would call him a traitor to the cause, saying he gave away too much.
CBS's Imtiaz Tiab. On Wall Street, the Dow gained 263. This is CBS News.
These days, better nutrition and stronger immunity are essential. That's why Eggland's Best gives you and your family more, so we can all be at our very best. Only Eggland's Best.
Well, we're learning about those giant Asian hornets coming up after KIRO Radio real-time traffic. Here's Kimmy Klein.
Well, for the first time this season, I-90 is shut down over Snoqualmie Pass between milepost 34 and 106 due to several crashes in the snow. Still no ETA of reopening, so use White Pass or Stevens instead. Elsewhere, it is just really wet. We have a crash in Tacoma, southbound 5 at 56, blocking 2 left lanes, keeping it busy from Highway 18. East of Edgewood, I'm hearing of a crash on Jovita Boulevard at 114th Avenue East. Your travel time from Renton to Auburn is just under 30 minutes, and then it's heavy on the Valley Freeway south of Algona. On to State Route 512. Seattle to Federal Way takes 45 minutes, but not bad into the north end. It's about 33 minutes to get from Seattle or Bellevue to Everett. This support sponsored by Staples Stores. Staples helps your business go big with everything you need at amazing prices, from office essentials like paper and ink to health essentials like masks and sanitizer. Save big at Staples. KIRO Radio Real-Time Traffic. I'm Kimmy Klein.
Now, from the KIRO Radio News Center at mynorthwest.com.
We could be on the verge of new coronavirus restrictions. KIRO Radio's Hannah Scott reports.
State Health Officer Dr. Kathy Lofi says the virus is growing at a very dangerous rate and now leading to significant hospitalizations that threaten to overwhelm our healthcare system and force new restrictions.
Everything is on the table at this point.
The only way to stop it is for all of us to redouble our efforts on face covering, social distancing, and avoid gatherings, especially large indoor gatherings.
That means Thanksgiving. Keep get-togethers small, 5 people or fewer from outside the household. Dine outside if possible. It's not the stockpiling we saw earlier in the pandemic, but it is getting tougher to find certain items at stores.
I used to buy Lysol all the time. Can't find that. Just hard to buy your special stuff you used to clean with all the time.
Kroger-operated QFC and Fred Meyer stores are now limiting certain items like disinfecting wipes and toilet paper. It varies from store to store. The Pierce County Sheriff's Office is mourning one of its own. A deputy found unresponsive today. CBS's Lauren Donovan reports.
Deputy Daryl Shuey joined the Pierce County Sheriff's Department back in 1994. He had just started his shift this morning when it's believed he suffered a medical emergency.
Potentially, each of those queens could be a new nest next year.
Scientists believe there are at least 2 more nests in our state. They're working to eradicate the hornets because they prey on beneficial bees. The European Union hits Amazon with antitrust charges. GeekWire co-founder Todd Bishop tells Seattle's Morning News.
This is really the escalation of antitrust scrutiny of Amazon around the world now.
EU investigators accuse Amazon of using non-public data from independent sellers to push Amazon's own products. The Seattle-based retail giant refutes those claims. Your KIRO radio forecast calls for clouds tonight with lows in the upper 30s. It's 45 in downtown Seattle. I'm Heather Bach.
For breaking news, highlights, podcasts, and more, download the KIRO Radio app. KIRO Radio, here for what's next.
You're listening to the Tom and Curly Show. I'm Tom Tangney. John Curley is away today. Felix Spinell's been filling in. We've had a great afternoon so far, but you know, it just isn't the Tom and Curly Show without a visit from this next person who practically defines the heart of the news on the Tom and Curly Show. Take it away, music. That's right, everybody. It's Hannah Scott. How are you, Hannah?
Great. What a wonderful introduction that was. Thank you.
Hey, I haven't talked to Hannah since the big radio play a week or so ago. Nice job on your part there, Hannah. You were fabulous. You're going to be in the next one for sure. Don't worry.
Oh, okay. I did agree to that, didn't I? No, that was fun. It was super fun. I had a good time.
What kind of, just quickly, we'll get to the heart of your visit here, but what kind of part did you have?
I was this is so fun, young radio producer.
Oh, so you were playing a distaff version of Jacob.
Yes. It was fun.
Well, thanks to Felix for all that. Those wonderful radio plays. Okay, so Hannah, I can't remember. I was trying to think of the title. I first saw this announcement of a press conference from the health department. It almost made it sound like it was an emergency press conference or something. Something is up, and I also think I heard over the news that somebody was comparing what's happening to the coronavirus, either in this state or this country, to a wildfire. How bad are things getting?
They were, actually, and a wildfire that is... And we are the fuel for it. I believe that was Dr. Jeff Duchin who said that. I didn't pull that cut. But it was pretty powerful. And I did, same as you, I got the release about today's press conference yesterday, and it said urgent in the subject line, yes, which is not normal. In fact, I'm not certain that I even saw that at the beginning of the pandemic. So it's been kind of growing. They started telling us about the surge in cases a few weeks ago as we started entering kind of this third wave. But over the last like a week back, maybe a couple of weeks back, there was some thought that perhaps things were maybe going to level out. That is not what's happening. State Health Secretary John Weisman explained.
We are really concerned at this point with what we are seeing in the trends and believe that immediate action is needed now to flatten the curve. We've been talking with you about the fall surge now for a number of weeks, and we're seeing an acceleration of that. And we think, the most serious consequences are yet to...
Oops.
severe. So we don't want this to take a toll again on the state's economy and on our people, and really need everybody pulling together to flatten the curve once again.
And so what's happening is now at the state level, they're seeing more sustained now for over a week, I believe, of well over 1,000 cases a day, which is higher. I think we had one other time, or maybe in the middle, where we saw 1,000 or so cases. Now it's been almost up to 2,000 cases on some days where we were in the 1,800 range, but it's now 1,400 a day, and that is widespread. It's all over the state, mostly though in Western Washington, but it's again widespread and it's not just in your older people. There are people of all ages, of 30s, 40s, 50s, getting sick. Those are some of the people who are also dying. Unclear, they didn't mention on whether this involved, underlying health conditions, but they're very concerned as we move into this holiday season. And it's possible that some of this rises due to gatherings on Halloween. But moving into Thanksgiving, the Assistant Health Secretary says they're strongly urging everyone to skip in-person get-togethers.
The safest Thanksgiving is one celebrated only with the people in your immediate household. You can certainly link in your extended family by web, but this is the safest option at this time. For those of you that want to have a small Thanksgiving, please make it outdoors. Please limit it to no more than 5 people outside your household. And you should seriously consider a full quarantine for the 2 weeks prior, which starts very soon. This means only leaving your home for essential things like groceries or prescriptions, or a brief walk around the neighborhood. When Thanksgiving is here, go outside, stay 6 feet apart, and please wear masks. It's important to remember that we can get COVID from people we know, love, and trust who may not yet know they have it or be asymptomatic.
So so you want to quarantine yourself if you absolutely have to be in person, getting together with people outside of your household for Thanksgiving. They want you to stay home. It's quarantine yourself for 2 weeks ahead, so there's no chance that you pick it up asymptomatically and spread it elsewhere. And really, Dr. Kathy Lofi, who's the state health officer, said the best course of action for everybody right now is to eliminate all social gatherings, period. That's how concerned they are about this. At the local level, Snohomish County Health Officer Dr. Chris Spitters went over the numbers today.
In Snohomish County, we've seen a shocking increase in our 2-week case rate. From October 31 through November 7, we saw a 50% increase in the 2-week case rate from 125 up to 189 cases per 100,000. Countywide, test positivity has more than doubled in the past month and is now around 6% countywide. Our largest clinic system had a 10% positivity rate last week and showed 15% positive over this past weekend. Cases in long-term care facilities have increased from a few per week to over 20 per week during the past month. The number of COVID patients in Snohomish County hospitals has almost doubled in the past 7 days, from 25 to 44 as of this morning. 6 of those patients are on mechanical ventilators.
And that's a statewide issue as well. There were 228 new hospitalizations yesterday, and they're seeing the trajectory that, and because there's a lag, right? There's a 3-week lag or so in the cases being reported and then people ending up in the hospital. They know that even if we were to all do our part and manage to flatten the curve today, as we speak, they're still going to see this big growth in hospitalizations 3 weeks down the line because of that lag. And it's going to possibly overwhelm our system. It may already be what's going to happen, according to Dr. Spitters there. So they're concerned about that because just in general, the hospital beds, not having enough of those, but there's also a shortage of the medical staff, of the nurses specifically, that is a really, really big concern. So they're really, all of the health officials, and I think I saw this one other time during the pandemic where you had most of your local county health officials joining this press conference call, as well as every state level health official, someone from the governor's office to come out and just say, listen, here's your chance. All of you in this state, wear your masks, socially distance, stop getting together and gathering with just those few friends that you think it's okay, because that's how this is spreading, along with a variety of other ways. And if we don't stop it now, more restrictions are going to be on the way. Weissman drove this message home at the end of this press conference.
How close are we to the exponential growth is? We're much closer than we were 4 weeks ago when we started telling people the fall surge seemed to be occurring. and the slope is increasing right now to a point where we are very concerned, if not alarmed. That's why we, have all of us on this call today to really show a force of the local and state public health system coming together to say to the public, pay attention now, redouble your efforts now, reduce your social contacts now, and don't let your guard down.
So I mentioned that the hospitalizations were expected to trend upwards, and behind that, 2 to 3 weeks behind that is where you'll get the deaths. And so that's what they're concerned about. In Snohomish County, the rate for 100,000 jumped to 190. Pierce County, it's 198, astronomically higher than it was just a few weeks ago.
Wow. Okay, so this is the
there's so much going on. Yeah, go ahead.
Okay.
Go ahead, Tom.
I just feel sort of duty bound because this is the Tom and Curly show, and John is always snippy with you about these numbers. Let me just throw out what I think John's comment would be here, which is, why don't we all relax? It's not going to kill us. It's only going to kill, like less than 1% of us. Why are we so overreacting to this rise in numbers? People get over it. If there were this many people getting the flu, we wouldn't have a problem with it. What do you say to the skeptics out there, or the people like John who think that we are making too much of this?
I will say what I have consistently said to John, which is it's not just about the deaths, it's about the hospital system being overwhelmed. We are just really moments away, if this doesn't get under control in the next several weeks, where they will start to institute new restrictions. And while they say they'll be more targeted, they say everything is on the table, and that will include shutting down your dentists, your doctor's offices, your things like that remember how difficult that was on everyone. And it would be a very, very, very dangerous thing to do that when we're in the middle of flu season at the same time. So that's an issue. And then on top of that, because we are seeing the numbers so much higher than what we saw, I want to say it was like 650 was really the largest daily case counts we saw right at the very beginning of the pandemic, that first big spike. So the deaths, and we had many, many deaths related to that. And these are more than double those numbers. So you don't know what you're going to see with the deaths. On top of that, they specifically said today that some of those dying are in that younger group between 30 and 50 years old. So there's a lot, still a very new disease. It's only been not even a year. So all of those reasons are the reasons why you should be concerned.
Okay, Felix?
And I guess the message just ends up being so complicated because there are all these different numbers they're tracking, whether it's the positivity rate of the tests, hospitalization rate, and then like the lag in deaths that will come a few weeks later. I mean, you have to be almost an expert to pay attention to this stuff and know like what it all means and what it means in terms of if there's any behavior you should be changing. Because it seems like they always end even this really dire press conference and this urgent press conference with, redouble your efforts on masks and social distancing and all that sort of stuff. I sort of feel like that message has gotten to the people who it's going to get to. And I just wonder if this will just get lost in all the white noise after the election and all the other stuff that's going on. This sort of seems like this is sort of getting lost in everything.
I think that they are hoping that now that the election's over, perhaps some of the politicking will go away and not be a part of this. I don't know if that happens. But what I can tell you, I was on multiple calls today with these House officials. My sense is they are telling all of us, whether you buy into this or you do not, if you don't want this state to face restrictions and go to be the shutdown mode like it was before, some severe shutdowns are very likely, then you need to just do what they're saying to avoid spreading this. Wear the mask, stay inside, do whatever. Or their bars and restaurants are going to start to close down. And they were asked, David Postman from the governor's office was asked by someone from Como, I believe, why, if it's so dire right now, why don't you shut it down now? Why don't you put the restrictions in place right now? And he said, we don't want to. That is the last thing we want to do because it's going to really damage the economy. And they don't want to do that. So everyone's been put on notice. Do it, or if the cases go up, that's what's going to be the end result.
So right now, the argument to do this, especially now, is to flatten the curve. Now, John has mentioned in the past, we did flatten the curve, correct? When it was first hit us hard in the spring, we all, for the most part, played by the rules, and we did flatten the curve. Is it that the curve now, is back up and we have to re-flatten it? Where does the curve compare to where it was in the spring, say?
So I'm going to try to use this analogy. The original curve, the original wave, the bump, I'm looking at it right now on the state's website. That bump was about the size of the Cairo building, right? Just a couple stories, let's say. The one I'm looking at right now looks to be the size of the Freedom Tower in New York City.
Really?
It's significantly larger. The number of the middle one was a bit larger, and then this one is it's spiked up dramatically. And again, in just the last 7 days to 2 weeks, where the numbers are just growing out of control, which is a sign that you get to that exponential growth. And for listeners who don't know what that is, that's when it starts to dump. So 2 becomes 4, 4 becomes 8, 8 becomes, I forget the math, 12, and on and on and on and on, to where it explodes, and then you can't control it. Contact tracing becomes a moot point. It doesn't do any good anymore.
You know, it was fascinating. I heard virologist Angela Rasmussen is a regular on the Jean Ursula's show, and she talked about the dangers if transmission gets so, big that masks and social distancing won't even matter. That if it becomes that, if it gets that out of control, we won't be able to, stop it, which there's that exponential issue. Right now, there's still a chance, but to think that it could get so bad that the mask and social distancing wouldn't help enough is pretty startling.
And yeah, it's a very significant deal. The other big concern, the Snohomish County health officer said, there's new evidence that the spray, like when you speak, it can linger kind of there in the air for a few seconds. And if you've got even a few people not wearing masks who maybe have asymptomatic situations, they go and they pass it on, and so on and so on and so on. And then our schools never get reopened, where we don't have the kids back in schools, not because the kids are going to necessarily get it and get super sick, but the teachers might, the adults might. And there's just no normalcy. So I heard multiple health officials on this call today say, look, if you want the holiday season next year in 2021 to be back to what we used to have, you need to give it up this year. Do it virtually. Think outside the box. And I mean, I'm going to do that. I don't want to go back to the full-on lockdown like we had before. I know, and then they acknowledge everybody has COVID fatigue. They all have COVID fatigue. Our doctors, our nurses have COVID fatigue. It's tough, but now it's spreading in long-term care facilities a lot again. We're heading back to what we had in the beginning, and that's going to be a problem for everyone.
Yeah, there's kids coming back from college. A lot of schools are ending the semester right before Thanksgiving and moving completely online, so kids can all come home from whether they're in college across the country or some part in Oregon or something. We have thousands of kids on the move in the next few weeks, coming back to their hometowns and spreading what they might have picked up, asymptomatically.
Yeah.
So it's boy.
It's concerning, and no matter
Thanksgiving 2020.
No matter which side you are on this, you really should listen to what they're saying. If you just simply don't want the restrictions back in place, wear your mask. They're going to be watching. They've got people that report on these things. Bottom line, if this explodes again and they have to lock everything down, everything we've done since March will not have mattered.
Yeah. Wow. Well, thanks for the cheery news, Hannah.
You're welcome.
Happy Thanksgiving, everybody.
Yeah.
Save me a drumstick.
That's right. Okay.
I'll give a happy story later in the week.
Yeah, that's good. Okay. There she goes. Hannah Scott, the heart and soul of Cairo Radio News. Okay, and